Hi, I'm Jacob Hornberger, president of the Future of Freedom Foundation, and this is this week's Libertarian Angle. The show, as most of you know, brings you the principled and compromising case for libertarianism. And I'd like to invite you to come to our website at fff.org. If you're new to FFF, for 31 years of principled presentations on the libertarian philosophy, visit our multimedia section where we have tons of videos from conferences that we've held. Subscribe to this YouTube channel. Subscribe to our FFF email, FFF Daily, which provides, we think, one of the best, if not the best, libertarian commentary pages on the internet on a daily basis for free. And then subscribe to our monthly journal, Future of Freedom. And if you like our work, support our work with a tax-deductible donation. So I want to do an update analysis on the healthcare situation. For practically a year now, you've had some libertarians just focusing all their attention on, what the federal government and the state governments and the local governments are doing with respect to mandates and mandate this and mandate that and masks. And then in the beginning, remember, there was the mask shortage and there was the ventilator shortage and there was all kinds of chaos with respect to addressing the pandemic, which we would expect since the government's in charge of the operation. But it's what I called whack-a-mole, that you could spend your entire time whacking these moles as they were popping up. A mandate here, lockdown, let's not forget the lockdowns, lockdown there. And it just went on and on and on, where you had libertarians as well as conservatives whacking these moles one at a time. And I kept saying the entire time, I said, okay, this is fine. Trying to improve the situation, the serfdom situation under which we live, but it's not freedom. It's just not freedom. Freedom is getting government entirely out of healthcare, a separation of healthcare in the state, just as our ancestors separated church and state. And so if we want a free society, that's what we have to go for. It's not enough to just whack these moles. And then as the pandemic was winding down, or appeared to be winding down, you had these conservatives and these reform-oriented libertarians saying, well, okay, now we can go on to other things. But I kept saying, well, what about the next pandemic? We're going to face the same thing. We're going to be whacking this mole and whacking that mole. While if you had freedom, healthcare freedom, where government was prohibited from involving itself in healthcare, you wouldn't have to be worried about it, because government would lack the power to engage in these mandates and lockdowns and vaccine passports and so forth, because it simply would be denied the power to engage in these kind of activities or these kinds of programs. So lo and behold, it's not a new pandemic, but all of a sudden the Delta variant surfaces. Now, at some point before the Delta variant really started to get going, you had these conservatives and libertarians saying, okay, well, now we can move on to new things. The pandemic's over. There's enough people that got vaccinated. We've reached a critical mass, and we can move on now. Well, then the Delta variant. So now we're back to whack-a-mole again. Now we're dealing with the vaccine mandates and the passports and the lockdowns and the mask mandates. And it's like, deja vu all over again. And this is what I keep saying. The Delta variant phenomenon is really a confirmation of what I've been saying from the beginning, that those conservatives and those reform-oriented libertarians that focus their entire attention and focus people's entire attention on, just whacking these moles, this mandate and that mandate and that mandate. Okay, it might make things better, but it's not freedom. It won't ever be freedom till you get government out of the healthcare industry entirely. So what I'd like to do is just review where we are in terms of both the federal government and the state and local governments with respect to health care. Now, in ancient times, or from the beginning of government, government has had certain inherent powers. That's been the assumption, that with government comes inherent powers. And these are called the police powers. Now, we all know what the real police power is that when the government goes out and captures a suspected murderer or rapist or thief, and then it arrests him, it prosecutes him. If he's convicted, he's put into jail, he's fined. That's the traditional police powers. But historically, the so-called police powers have extended beyond that. They're often described as powers for the health, safety, morals, and welfare of the people. And the idea is, under this inherent powers doctrine, that government has inherent powers to legislate or enact laws where the health, safety, morals, and welfare of the citizenry is concerned. So as libertarians, none of us would object. Well, I guess the anarchists would object, but those of us that favor limited government would not object, obviously, to the government exercising its powers to protect people from violent criminals. Okay, traditional police power. Where we separate out, though, as limited government libertarians, these other issues, the morals, the welfare, the health of the citizenry. We say the government has no role in this area. But historically, that's been the case. Now, when the Constitution called into existence the federal government, it could have just said, we're calling this government into existence, period. Now, it never would have been approved. When the Constitution was being proposed in Philadelphia, it had to be accepted. Americans had been operating under the Articles of Confederation, which is a totally different type of governmental system. It's one in which the federal government's powers were so weak by design. People didn't want a powerful government, that the federal government didn't even have the power to tax. Imagine that. The federal government operating for a decade or so without any power to tax people. And that's the way Americans wanted it. So when the Constitution calls the federal government into existence, it's with the understanding that its powers are extremely limited, because that was the only way they could get it sold. If you had told the American people in 1791 that the Constitution was calling into existence the type of government we have today, a welfare warfare state, a national security state, they would have laughed. They would have thought it was a joke. And they never would have accepted it once they realized that it was a serious proposal. They would have just summarily rejected it. They didn't want the type of government we have today. That was the last thing they wanted. And so the Constitution calls into existence a government with extremely limited powers. That's the way it got accepted. It would have never been accepted had it been a government that had general powers to legislate for the health, safety, morals, and welfare of the people. So the upshot of this is that the federal government is not your standard historical government that comes with inherent powers. Instead, it is a government by design of limited enumerated powers. And what are those powers? They're the powers that are just listed right there in the Constitution. So if a power doesn't exist, it can't be exercised. Now, there are those who say, oh, well, Jacob, no, the Constitution is designed to promote the general welfare, and therefore it can do anything to promote the general welfare. Well, what they're referring to is the preamble, which is not a grant of powers. It's just a reasoning as to why they're proposing the Constitution, which is proposing that the federal government be called into existence. They're saying that for the general welfare of the people, we're presenting this plan. But this plan entails a limited government republic. Because obviously, if they had called into existence a federal government of general powers to legislate for the general welfare of the people, there would have been no reason to enumerate the limited powers. That would have been ludicrous. They would have just said, well, there's no reason to enumerate these limited powers. The government's got the power to do whatever it wants. And so it was a limited government republic. And it was like that for 100 years. And so the federal government had no power to legislate for the health of the citizenry by design. So you've got this situation where you've got a federal government with limited powers that do not include legislating for the health of the citizenry. Now, the states were a different matter. The state governments had this traditional historical power to legislate for the health, safety, morals, and welfare of the citizenry. They were in a different stead than the federal government under the provisions of the U.S. Constitution. Now, a state could enact a state constitution that limited the powers of the state. It could say, well, we don't want the states to have these inherent powers. We want the state to have only the police power to go after murderers, rapists, thieves, and so forth. But if they don't do that, the idea is that the states stand in a different position than the federal government, that they still have these inherent powers to legislate for the health, safety, morals, and welfare of the people. So when we look at things like Medicare and Medicaid, and then the Centers for Disease Control, the FDA on the federal level, we're really looking at two separate parts of the federal government with respect to health care. Now, when we talk about Medicare and Medicaid, we're talking about the providing of health care for people. In this case, seniors, the poor. There's statists now that realizing that their system is such a failure that they want to go further, and they want Medicare for all. They want the government to provide or guarantee health care for everyone. In other words, a totally socialist system rather than a partially socialist system. Now, when I say partially, I'm still saying it's huge. I mean, Medicare and Medicaid are gigantic. I mean, they were really responsible for having destroyed what had been the finest healthcare system in history. I mean, America, that was one of the great contributions that America made to the world. We had the finest healthcare system in history. A free market healthcare system, and it was one in which prices were low. Hardly anyone had major medical insurance. They might have had catastrophic insurance in case they got cancer or something like that, where there'd be long-term expenses involved. But in terms of just major medical, nobody had that. Why? Because healthcare costs were so low. It was like going to the grocery store. Who has grocery store insurance to protect against soaring grocery store prices? Well, you might pretty soon due to the Federal Reserve's inflationary policies. But people would just go to the doctors and they just pay like they were going to the grocery store or getting their car repaired. And the poor, they were being handled by doctors on a purely voluntary basis. The doctors did it out of a sense of obligation, moral obligation, that they were making a lot of money. I mean, doctors were among the wealthiest people in society. They were making a lot of money. And especially when income taxes were low, and so they said, "Well, okay, we're gonna help the poor on a voluntary basis." In my hometown of Laredo, the doctors' offices were filled. Laredo was a really poor town when I was growing up, and doctors never turned away anyone. They knew that most of the patients out there in the waiting room couldn't pay. They just treated them, and they were still among the wealthiest people in town from the people who were paying. And that's the way it should be. And you had a healthcare industry that was vibrant. Doctors loved what they were doing. And they made house calls, if you can believe that. And the inventions that were taking place were phenomenal. I mean, the tremendous exponential advances in healthcare. And again, healthcare prices were very, very low, very stable. And then Medicare and Medicaid come into existence. And that's what ended up destroying the healthcare system. The healthcare costs started soaring. People started blaming that on the free market, as if Medicare and Medicaid are free market. And then that called for more interventions and more interventions and more interventions. And of course, nobody talked in terms of just eliminating the original socialist programs, Medicare and Medicaid. And this brings us today to the libertarian movement. I mean, you've got very few libertarians that, are calling for the repeal of these socialist programs, the immediate repeal of them. That they've fallen into this mindset. Well, a lot of them are conservatives and Republicans that have come into the libertarian movement. And as we all know, Republicans and conservatives threw in the towel on the welfare state decades ago. After Barry Goldwater got smashed by Lyndon Johnson in the '64 election, Republicans said, well, we've got to accept that the welfare state's here, Social Security, Medicare, Medicaid, farm subsidies, etc. And so they accepted it, and they just came up with reform packages like health savings account. Well, that's what happened with the libertarian movement. They were influenced heavily by these conservatives that would come into the movement and not be able to let go of their baggage. And so today you've got a large portion of the libertarian movement that are loath to call for the immediate repeal of these socialist programs. They feel like they won't be taken respectively. They might not get votes. They want to be credible in mainstream America. And so the only hope for getting out of this thing to the restoration of a free market healthcare lies with libertarians, but you've got libertarians that are just scared to death to call for these. And many of them are themselves convinced that, it would never work, that if you repeal these socialist programs, you would end up with people dying in the streets. In other words, a lack of faith in freedom. Well, I don't have that lack of faith. You could dismantle these programs today, which is what you should do, and everybody would be fine tomorrow. There's no question about it, because freedom really does work. The free market really does work. And then the other side of the federal government is the central planning side, and that's the Centers for Disease Control, FDA. Now, we hardly ever really focus much attention on them as libertarians because they weren't playing a huge role. Now, okay, the FDA would cause drug companies to wait umpteen years before they would approve a medicine, and we would hear about the FDA. But and then the Centers for Disease Control. I guess every once in a while people would hear about them, but they were always there. They're a central planning agency. They're different from Medicare and Medicaid, but they're still the federal government's involved in healthcare here. And again, where is the constitutional mandate for either Medicare or Medicaid or the Centers for Disease Control, the FDA, the DEA? That's another aspect of this thing. Where's the constitutional provision? There's none. There's none. But you see, we live in an era where that's just not considered important anymore. I mean, this was the charter that brought the federal government into existence, and nobody cares about whether it's authorized or not. Certainly the federal judiciary, which is supposed to enforce it. I mean, this was the tsunami of the welfare state that took over America. Predominantly in the 1930s. The seeds of it were being planted in the late 1800s with the progressive movement. But once the tsunami hit, it overwhelmed the Constitution. People sometimes say, well, the Constitution didn't work, Jacob. Well, actually it did. Because it worked to do what it was designed to do. It's like a seawall. A seawall is designed to protect an oceanside community from high tides. And so it does that over many, many years, and so it's a success. Well, one day a tsunami comes in and just overwhelms the town, just destroys it. And so one might say, well, the seawall didn't work. Well, the seawall did work. That wasn't its purpose. The seawall worked to protect against high tides, but it was never designed to protect against a tsunami. And so you can't say that it failed to protect against the tsunami because that wasn't what it was designed to do. Well, it's the same thing with the Constitution. It wasn't designed to protect against a tsunami of public opinion that wanted a socialist system. And it was overwhelmed by the welfare state sentiment that was taking place in the 30s and then even grew larger. And then again, the second tsunami of the warfare state or the national security state that came into existence in the 1940s. So that we now live under a warfare state. Well, the Centers for Disease Control comes into big prominence during this pandemic, with its chaos. First of all, the shortages of the ventilators and the masks and the hand sanitizer. I mean, let's not forget about those early weeks and months of the pandemic. It was just total chaos. It's what Ludwig von Mises called planned chaos in the healthcare industry. That's what it would be called, planned chaos. What better term for that phenomenon? And then you don't have them imposing mandates generally across society, but make no mistake about it, they claim the power to do so. They just haven't exercised that power. But they over there telling states to do it, to enact mandates and so forth. And then of course they do in their own limited way have their own mandates with respect to their own employees and so forth. But at the very least they didn't impose a nationwide lockdown, that type of thing. But they're still involved in this process. And this is what I'm saying is that in order to achieve a free society, we will never, ever be free till we get, first of all, the federal government totally out of healthcare. Okay, now how do we do that? Well, we do it the same way we got religion, churches out of the federal government's hands. And that's that First Amendment. I mean, imagine if our American ancestors had said, well, okay, we're going to let the federal government centrally plan religion. Well, there would have been a huge mess. Imagine the fights with, which ministers are going to be permitted and which church districts are going to be permitted to exist and who's going to run them, Catholics or Protestants or Muslims or, the mosques and, the synagogues. Who's going to run all this thing? And there would be arguments over, church vouchers and so forth to get, children out of the public churching system. And, well, to avoid all that, thank goodness that our ancestors just separated church and state entirely. We don't have to have any of those debates. There's no Center for Religious Control in the federal government. Okay, I mean, that's what we need at a federal level. And so what I'm doing here is I'm trying to raise people's vision to a higher level here. I mean, you can spend the rest of your life as a libertarian just fighting the moles. Whack this mole, whack that mole, whack that mole. But wouldn't it be fantastic if we were to go on to, from this life knowing that we left a much bigger legacy like our ancestors did with separating church and state, where we leave the American people with a new system that separates out healthcare in the state, at least at the federal level, where like a constitutional amendment that says no law shall be enacted respecting the provision of health care or regulation of health care or abridging the free exercise thereof. In other words, full health care freedom. Then when something like this happens, it's up to the healthcare industry to get us out of it. They provide the guidance. They provide the recommendations. This is what we recommend for restaurants. This is what we recommend for this. And then let each place decide for itself what to do. And that way you don't have this massive lockdown situation where you're closing everybody down, where people are free to make their own decisions, and people are rational. They figure out what's best for them. So on the federal level, if we want freedom, and I think that's what libertarianism is really ultimately all about, we need a separation of healthcare in the state. And we need to make that case, because if we don't make that case, if all we do is just spend our time whacking this mole and whacking that mole and mandates this, Jacob, and lockdowns that, and passport, vaccine passports, and all this stuff, whacking these moles as they pop up, we're not raising people's vision to that higher level of what freedom is. And if we want freedom, a necessary prerequisite of that is separating healthcare in the state. Now, what about the state level? Well, I would argue it's the exact same thing. That we want to get the states out of this inherent powers business, at least with respect to healthcare. We can talk about the others, where I would stand on the morals and that type of thing. Government has no business legislating morals. But let's stick with healthcare. That what we need is a system where we don't have to be whacking all these moles. The governors imposing lockdowns and mask mandates on people. Let each business decide for himself what he wants to do. People would look to the healthcare professionals again, the healthcare industry. They would be posting recommendations, and then people would be making their own decisions. But as of right now, the state has that authority. In fact, there's an old case from 1905, Jacobson versus Massachusetts, where the Supreme Court upheld the power of the state of Massachusetts to force people to undergo smallpox vaccinations. And they said that there was this outbreak and that this was for the health of the citizenry. And they were forcing people to undergo these vaccinations, which still befuddles me, because if you get a vaccination, at least on a smallpox thing level, why would you worry about whether somebody else has smallpox or not? I mean, presumably the vaccination protects you from getting the smallpox. So why would you care what somebody else does in that sense? But again, if we want freedom, we've got to make it so that the state is out of this thing too. And that could be done at the state level with a state constitutional amendment. And when I say state, we're talking about the state government and the local governments as well, because technically, the state and local governments, subject to whatever the state constitution says, all have these inherent police powers. These are the inherent powers of government that have existed since antiquity. They came into existence when the Constitution called the federal government into existence. The states were, in the 10th Amendment, they have all the powers not delegated to the federal government unless expressly restricted. Like the Constitution prohibits the states from making anything but gold and silver coin legal tender. Yeah, they really followed that one, haven't they? But unless there's a restriction there, the states have these inherent powers. And one of the powers they did was the power to regulate health care. And so that gives them, under these inherent powers, subject to their state constitution, which might prohibit this type of thing, but most likely doesn't, they have the power to impose these lockdowns and mask mandates and so forth. So what's the solution there? Well, again, my model is the 14th Amendment, that we enact a constitutional amendment that separates healthcare in the state, not just at the federal level, but at the state level too. So no law shall be enacted by either the federal government or the state governments respecting the provision of health care or the regulation of health care or abridging the free exercise thereof. That way we prohibit in one constitutional amendment both the states and the federal government from getting involved in health care. Now we're talking about real freedom. Now, obviously, that's not going to happen today. It's not going to happen tomorrow. But in order for it to happen, people need to start thinking about it. If you're not ever exposed to what freedom really is, then you're not likely to start thinking about it. And this applies to all aspects of freedom. Like educational liberty. If all people hear is the case for school vouchers as a way to reform the public school system, it's very unlikely they're going to be thinking in terms of what real freedom requires, and that's a separation of education in the state. And so the only hope for achieving a free society lies with us libertarians. You're not going to get it from conservatives. You're not going to get it from progressives, the liberals, the leftists, whatever label you want to put on people on the left. You're not going to get it from any of these people because they believe in the welfare state way of life. They believe in the warfare state way of life. They believe in socialism. They don't call it that. They don't like to be told that, but that's what the whole welfare state is. It's a socialist construct. They believe in the income tax, the IRS, Social Security, Medicare, Medicaid, public government schooling, fiat paper money, Federal Reserve, the Pentagon, the military-industrial complex, the CIA, the FBI, the NSA, torture, coups, assassinations, immigration controls. I mean, the list is endless as far as their welfare state, warfare state goes. And none of these things were in existence for the first 100 years of American history. None of them. Because Americans rejected that way of life. And so, now, if you don't want to be free, if that's not important to you, you can sit there and whack these moles all you want and say, okay, Jacob, I'm going to whack that lockdown mole. I'm going to whack down that vaccine passport. And that's fine. But, I mean, there shouldn't be any pretense about this. My beef with libertarians that spend their lives doing this is that they say it's freedom. We've achieved freedom by stopping these lockdowns. No, you haven't. As long as government is in charge of health care, you're not free. And so I don't have any problems with libertarians, arguing for reform and trying to improve the situation. What my beef is the suggestion that this is advancing freedom. It's not advancing freedom. It's advancing reform. And reform is not freedom because reform keeps the apparatus, the infringement on freedom intact. It keeps Medicare intact, Medicaid intact, occupational licensure intact, the Centers for Disease Control intact. So you may succeed in getting these lockdowns reversed or whatever, but as long as the state's got the power to do these things, you don't know what lies around the corner. And then, when a new variant comes along or a new virus comes along, we're right back at it again. But notice the peace and tranquility that comes with a constitutional amendment that says you don't have the power to engage in health care anymore. Just like you don't have the power to engage in religion. Now we're looking at an entirely different situation. Now we're looking at freedom. And in order to achieve that kind of society, we've got to be talking to people in terms of what freedom is. And that's the only way to find the people that say, wow, I never thought about that before. People like us that want to be free. I had never heard of these ideas when I first discovered libertarianism. And fortunately, when I discovered libertarianism, it wasn't because of reformers. If I had discovered the case for reform of the welfare warfare state, I never would have discovered I was a libertarian. It was because I discovered essays, articles where people were talking about genuine freedom and what genuine freedom really is that caused me to realize, hey, that's me. I'm a libertarian. And then it also caused me to say, I want to be free. you go in this journey from birth to death, and during a large portion of it, you're told that you're free. You're convinced you're free. And then all of a sudden, the libertarianism helps you to shatter that myth, that falsehood. And when I broke through, it was just a revelation. But the only way I broke through was because I happened to read essays by people that were talking about genuine freedom, not reform. They were talking about, if we want to be free, you've got to do things like separate healthcare in the state, get government out of economic activity, get government out of education. And now we're talking about genuine freedom. So that's my analysis for this week on healthcare. And thanks for tuning in. And again, if you're new to FFF, come and visit us at FFF.org. Subscribe to our FFF Daily. It's free. We strive to make it the best commentary page on the internet. Our multimedia section, which videos by our conferences. We got a conference coming up this fall, a series of lectures on the critical importance of civil liberties. It's called Restoring Civil Liberties. And we got a great lineup for that. So if you get FFF Daily, you'll get updates on that. Subscribe to our monthly journal, Future of Freedom. And perhaps most important, give us a hand with a nice tax-deductible donation. Thanks so much, and I hope you're having a great summer, and I'll talk to you all next week.